Hi guys, this is Dr. Nida with Keys of Health. In this video, we will look at some early signs of kidney diseases. It makes all the difference in the world if you catch a disease in its early stages as opposed to its advanced stages. It is much more possible to treat a condition when it is just beginning. You can stop its progression and even reverse some of the damage. Depending on how advanced the kidney disease is, the diet looks different. Kidney disease is usually 5 stages. Stage 1 is mild and stage 5 is complete kidney failure. These stages are based on how well the kidneys can filter waste and extra fluid out of the blood. When a person starts to reach stages 4 and 5, they have to avoid certain things in their diet like potassium, phosphorus, sodium, and some other things. All these nutrients are good for kidneys, especially potassium, but when the kidney has been damaged to a certain extent, then it can no longer handle potassium intake and it should be avoided. So let's talk about some of the early signs of kidney disease. These early signs of kidney disease can really protect you from a lot of suffering. And I believe that everyone should know these signs because our modern lifestyle and food choices put us all of us at a very great risk of developing kidney and liver diseases. Our kidneys are filters. If the filter is dirty, it will not do its job properly, and that's what causes these signs and symptoms. All right, so first of these signs is metallic taste in the mouth. If you have metallic taste in the mouth, it is time for a kidney detox. Another sign is if your breath or urine smells like ammonia. If you have fluid retention, that's another sign of kidney problem. So you will have swollen feet, ankles, legs, hands, and even neck and around the face for some people. Sudden meat aversion is one of them. So you have never had a problem eating meat, and now all of a sudden you have a dislike of meat. Another sign is nausea and vomiting. This doesn't have to be all the time, but once a day or once every few days, you have this feeling, and this shouldn't be ignored. Another sign is you have difficulty concentrating or you get confused easily. Itchiness or rashes, when the kidneys are not doing their job properly, the buildup of waste in your blood can cause severe itching or hives. There's a loss of appetite, which that can also be a sign of kidney problem. Decreased urine output, although it is not consistent and sometimes urine output is normal. And another sign is weakness. You will feel certain weakness in your body. Our kidneys are amazing. They're a very sophisticated filtration system. The blood goes through, they recycle, and get rid of the waste. Now, of course, you don't want to self-diagnose any condition. One of the best indicators of kidney functions is to check the GFR. This is a measurement of how well the kidneys are acting as a filter. This looks for creatinine in the blood. Creatinine is a type of protein. They also look for BUN, blood urea nitrogen. One of the biggest causes of kidney damage is diabetes or prediabetes. So if your glucose levels are high, it begins to damage the little filters in the kidneys. So high consumption of sugars, refined carbs, and starches over time take a toll on the kidneys. Regardless of what level of kidney damage, a good healthy diet is extremely important. You should be eating a lot of leafy greens, avoiding refined carbs, drinking good water. You want to avoid hard water, especially if you do have some kidney damage. And you should also look into detoxing your kidneys. I have done a video on good foods for kidneys. You should definitely check it out. And I will do another video on herbs and some drinks that are good for kidneys and can help reverse some damage. So keep an eye out for that. This is it for this video. Thank you for watching. If you haven't subscribed yet, please do so now. I'll see you shortly. Take care. Goodbye.